discussing a recall history that is autism. So the task come on exam number one is that 5 years old girl with tuberous sclerosis with features consistent with autism, anxiety with routine change, needing routine, etc. Then another time it comes 6-year-old girl with tuberous sclerosis who is now having vacant episodes which mom is concerned about. Took a detailed history exploring impact on the family as single mom. The seizure were atypical as it could happen when she is working and mom said that she had hurt herself on few occasions. Felt like a complex history and had to talk about surveillance scan for tuberous sclerosis. Special needs at school. I did miss the fact that she has been missing school due to these seizures. Discussion was overall okay. The examiner was very friendly, mainly talked about complex patient needs, specialist input, and impact on family. I felt like we had a general chat about it rather than an exam. Clear pass. So autism common exam that is associated with tuberous sclerosis. Tuberous sclerosis features we know that autistic features present that is and also seizure present, tuberous sclerosis, some skin lesions present. Uh, Now I am telling autism history. Exam cases are normally come Rett syndrome, tuberous sclerosis, Williams syndrome. Remember, Rett syndrome is regression occur. Another history I will discuss. Williams syndrome special features present and tuberous sclerosis. Also, autism associated with Fragile X syndrome, Sotos, and Prader-Willi syndrome. Now, what is important in autism history when we take Spinner's plus association plus syndrome? Spinner's is the it's a mnemonic. I will later discuss. So we spin as the features association associated any symptoms or not and the syndrome. Normally autism, speech delay, no eye contact, cannot express his needs, no social and emotional response, rigid routine, sensory processing disorder. These are the present. Now history, mother concerned like my son is in his own world or mother telling my child has tantrum behavior or abnormal behavior, bizarre behavior. So first we take ask the history, onset, course, and duration. Like when it's first you notice, how long he's suffering these conditions, what make it better and what make it worse. Can you describe from for me his behavior? What did you do for that? Did he lose any skills? Does he have a daily routine? What about his intellectual ability? Is he look like you and his daddy? Do you have any other concern? Did he have any chronic conditions? So these are question asked. Then Spinner's the autism features are as for speech. The speech of autistic child are delayed speech, repeat last words, echolalia, repeat last sentence like scripting, no active conversation. Then Spinner's P for PlayStation, play pattern that is not participated with children play, obsessed with his toy, obsessed with part of the toy. Then E, Spinner's E for emotional and social. There is no emotional response. If someone hurt, he doesn't care. Stay alone, tantrum, no social response. If someone give him gift, he doesn't care. Then Spinner's N for needs. How can he express his needs? Spinner's E for eye contact. No eye contact with when talking to him. No facial expressions, no pointing. Then R. Spinner's R for rigid routine, repetitive movements. And S for abnormal response to touch. So these are the features we find. And when we take association with the autism. So autism history, some association features we can find that is ADHD features, temper tantrum, they have sleep problems, language problems, nutritional problems, vision and hearing problems, self-harm. Did he lose any interest in something was enjoyable before and fits? Then we go the systemic review. Systemic review is in brief and targeted to the syndrome if present. In all scenario, tasks ask about thyroid status, very important. So we know that in systemic review, we ask about CNS, CVS, respiratory systems, GIT, one or two question, everything we touch. Then MSK, endocrine, these are. So here thyroid status very important, which whether he prefers as its risk factor for autism. Remember, thyroid is a risk factor for autism. Then CNS, feeds, bugs in brain, head size, hydrocephalus, and shunt if present, full analysis. Then accordingly, like Fragile X syndrome, then MSK and CVS, size of the private area, if we think it is Fragile X syndrome, Williams syndrome, CVS and renal, Prader-Willi syndrome, MSK, measures obstetric sleep apnea and nutrition. Past history, 5T IOA, 5T any trauma, any treatment he's taking on, any traveling history, blood transfusion history, any surgery, past any admission occur in hospitals, does he take any medications, was follow-up regularly or not, any operation before done, these are details we take. Then parental history is very important, preterm, and alcohol during pregnancy. So we ask about what time is that full-term delivery it was or not, because preterm one of the risk factor, and alcohol during pregnancy. Mother take alcohol or any illegal drugs, some disease associated with. But we ask vaccination, allergy, nutrition as usual, development, growth charts very important. That is some disease condition. These are short stature associated with that. Family, home modifications, social, school, psychiatry impact. So this is the history of autism. Uh, Exam case if tuberous sclerosis come. Now I am causes of autism and differential diagnosis. No specific cause, but some factors increase the risk. These are preterm less than 35 weeks increase the risk. Other siblings with autism. Lead poisoning. We ask that the child eating habit, nutrition habit, we understand, and also is there any construction work is going on? We ask, is there your home is old home or new home? Because some home has lead pipe. Inherited developmental disorders, thyroid problems, CNS infections, hydrocephalus, head size, very important in CNS asking. Inherited metabolic disorders, that is phenylketonuria, aminoaciduria, homocystinuria, syndrome or West syndrome, that is infantile spasm syndrome, neurofibromatosis, tuberculosis, fetal alcohol syndrome, Prader-Willi syndrome, Fragile X syndrome, Down syndrome, Williams syndrome, Soto syndrome, Angelman syndrome, lots of syndrome. Now about the management task, how can I manage? I will involve a multidisciplinary team, my consultant, pediatrician, developmental pediatrician, cognitive and psychological assessment, liable to the psychological problems mentioned them. So further psychological problem is if there is a speech problem, to go speech therapy like that. Educational workers, educational healthcare plan, they have special school needed, so educational care plan, healthcare plan will tell liaison with the school, then SALT, speech and language therapist, healthcare care visitors, social worker, genetic for syndrome, others according to cause. According to cause like tuberous sclerosis, our case tuberous sclerosis, what happened? There's a hypertension occur, so they go there, genetic counseling, autosomal dominant condition, family history, important here. And tuberous sclerosis, these are the in clinical you'll find all this. The neurologist for seizure, physiotherapy, orthopedic, ophthalmology, ENT, cardiology. According to we tell everything. So this is all about autism history. Thank you very much.